The issue of mismatch repair deficiency in breast cancer, it's such an exciting topic because we have to distinguish between tumors showing mismatch repair protein loss, and I'm talking about breast cancer showing mismatch repair protein loss, breast cancer showing microsatellite instability, breast cancer cancers showing high tumor mutational burden, a high number of mutations, and in general, breast cancer showing mismatch repair deficiency. So for other types of tumor, we are achieved in considering mismatch repair deficiency as a biomarker for a high tumor mutational burden. We know that tumors that show deficiency in the mismatch repair system, that is a crucial system that repair unpairs in our DNA, are likely to show a high number of mutations, also somatic mutations, and also microsatellite instability, that is a surrogate biomarker for the genome instability. However, in breast cancer, we at present don't have tumor-specific biomarker. We have an histology agnostic approval, but unlike for other kind of therapies, this approval didn't come with companion diagnostic, and it didn't come with complementary diagnostic test. So the issue is how to identify patients showing mismatch repair deficiency. We can use immunohistochemistry as we do for colorectal cancer or endometrial cancer, and that's a good strategy indeed. But we don't have tumor-specific clones. We don't have tumor-specific guidelines for the interpretation of immunohistochemistry. We have observed, and there are several groups that are working on that in breast cancer, mismatch repair protein expression show extremely high levels of intratumor heterogeneity. And in particular, we know that up to 13%, 20% of breast cancer based on the intrinsic molecular subtype are mismatch repair heterogeneous. What does that mean? We still don't know. However, if you look at the survival of mismatch repair proficient breast cancer, meaning breast cancer that show the expression of the mismatch repair proteins across all the tumor cells, and the mismatch repair heterogeneous breast cancer, meaning the breast cancer that show the expression in a heterogeneous manner, meaning spatial heterogeneity, these tumors have more or less the same prognosis, unlike mismatch repair deficient breast cancer that have a poor prognosis, particularly estrogen receptor positive breast cancer showing mismatch repair deficiency have a poor prognosis. Okay, so if you pay attention in pre-analytical issues and in validating your lab procedures, immunohistochemistry seems to be a valuable option for identifying these patients, providing that you are able to sample multiple areas of the tumor in order to identify mismatch repair heterogeneous cases that, in our experience, are behave similarly to mismatch repair proficient. So they are mismatch repair proficient clinically. There are other tests that can be performed in these tumors, such as microsatellite instability. The point is that we have some microsatellite markers that perform very well in tumors in which mismatch repair deficiency has been traditionally studied, such as endometrial cancer and colorectal cancers. And we have specific guidelines that have been approved, for example, by the Bethesda panel, but these guidelines seem not to apply to breast cancer. So again, we need to identify specific tests that can be employed in breast cancer to select patients that show high levels of microsatellite instability. And also the tumor mutational burden, that is the overall number of mutations, is still troubled by the lack of guidelines. So the main questions are what sample to test, what assay to use, how many areas in the genome should be analyzed, and what is the threshold to identify TMB high and TMB low breast cancer. So there are many groups all around the world that are still working on that, because we now know that to reach the goal of precision medicine, we need tumor-specific guidelines for selecting patients for specific treatment and management in general protocols.